All right, we are going to go ahead and get started. Thank you everybody for joining the webinar today, supporting Oregonians with disabilities to be tobacco free. This is a reminder to everyone to mute your phones unless you are a presenter. We will be recording this webinar so that this link will be sent out after the webinar is over. It might take a week to do that on our end, but we will make sure we get that out to all the appropriate attendees. And for questions at the end, we will ask that folks unmute your phone if you have a question, but we will make sure to prompt that at the end. And then there will be a survey link that goes out at the end of this webinar in a follow-up email from GoToWebinar that we would appreciate everyone to complete. All right, so I will hand it over to Angela Weaver.
Hi, good morning everyone. And again, thank you so much for joining us today for the webinar supporting Oregonians with disabilities to be tobacco free. My name is Angela Weaver and I'm the project coordinator for the Oregon Office on Disability and Health, and we are housed in Portland at Oregon Health and Science University, and we're funded by the Centers for Disease Control and Prevention. Now we're captioning. So we're trying to get our captioning to come back up here. So this webinar is brought to you today by the Oregon Health Authority, Special Olympics Oregon, and the Oregon Office on Disability and Health. And it is funded in part by the Centers for Disease Control and Prevention. And the contents of the webinar is the sole responsibility of the authors and does not necessarily represent the official views of the CDC. I don't know if I was right here. Sorry, we're trying to, I'll just keep going.
We're just trying to pull up the caption really quickly.
Yeah, it's not that one. Click that off. I don't know. Yeah.
It's going to go away though.
Mm-hmm. Okay. Well, we might not have captioning. We apologize. We'll have to figure out, maybe with the recording, we'll be able to do some captioning after the webinar. So our apologies for that technical difficulty. So I'm going to start the webinar by sharing with you some data and information regarding tobacco use. So this chart clearly indicates that the #1 leading cause of preventable death in Oregon is tobacco use. And this chart is from a public health report summary from 2012 and is sharing 2009 data. And we see that the tobacco use accounted for approximately 7,000 fatalities in 2009. And the good news is that the smoking rates have decreased over the years. However, tobacco use still remains the #1 cause of preventable deaths in Oregon. So this next slide, it has a lot of information and I'm not going to cover everything. But basically what this slide details is that it shows both the direct effects of smoking on the body as well as the impacts of secondhand smoke. And the takeaway from this slide is that smoking and secondhand smoke impacts the entire body. And new research is coming out all the time that just shows more and more how tobacco use and secondhand smoke affects the body. So, and a lot of people don't realize that. So this next slide is sharing BRFIS data, and BRFIS stands for Behavioral Risk Factor Surveillance System data. And this slide shows the number of current smokers in Oregon using 2015 data. And it's delineated into selected groups, including people with disabilities. And as we see, about 47% of people with disabilities indicated that they are currently smoking compared to just 17% of the general population. And it's important also to point out that people with disabilities have the highest prevalence of smoking of all the groups. And lastly, the slide also shows how tobacco use is a health equity issue. So the next slide we are looking at cigarette smoking by insurance status. And this shows us that 34% of people currently on the Oregon Health Plan indicate they are currently smoke versus 28% of people with no health insurance. And lastly, 13% of those who have insurance indicate they currently smoke. In addition, the Oregon Health Plan spends approximately $374 million per year to treat smoking attributable diseases. And again, this also reiterates the point of tobacco use being a health equity issue. So because because of all the information and data that I've shared with you, and that tobacco use is a health equity issue for people with disabilities, the Oregon Health Authority, the Oregon Office on Disability and Health, and Special Olympics Oregon, we've all come together and partnered to create the Tobacco Education Project for people with disabilities. And the goals for our project are the following: to reduce tobacco use among both Oregonians with disabilities and their service organization providers who provide support to them, increase the number of disability service provider agencies and health organizations like Special Olympics to become referral resources for the tobacco quit line here in Oregon. And then lastly, to increase the number of agencies that become tobacco-free workplaces. And now I would like to pass the presentation on to Alicia.
So hello, I'm Alicia, and I am the Healthy Communities Coordinator for Special Olympics Oregon. And my job is to support the vision of Special Olympics Health, which is create a world where people with intellectual disabilities have the same opportunities to be healthy as people without intellectual disabilities. So basically, my role is to infuse opportunities for health promotion and quality health care for people with intellectual disabilities throughout Special Olympics Oregon programming and events and competitions. Next slide. So the focus on health is actually an international priority for Special Olympics and has been incorporated in their 2016 to 2020 Global Strategic Plan. And as you can see here on the slide in Goal 1, Special Olympics wants to improve the opportunities for athletes to perform at their very best. And of course, what that would involve is a strategy that I circled here at the bottom, is to improve athlete health to not only support their participation in sport, you need to be healthy enough to participate in sport, but also to be healthy in society as well. Next slide. So the Special Olympics Healthy Athletes Program is an essential part of that strategic plan to improve health. The Healthy Athletes Program provides free health screenings in a very welcoming environment. So these are health screenings that are provided at local, state, national, and even world games, and they're just held right at the sports competition. So it's fun, welcoming environment. We bring clinical directors in from different disciplines like optometry and podiatry, physical therapy, doctors. They come to the competition for these screenings. The program educates athletes on healthy lifestyle choices, including tobacco use. It identifies problems that need additional follow-up, and this including tobacco use. So when we ask athletes if they use tobacco products, we are going to be now talking to them about the risks and asking them if they want to quit. And now we are going to be providing them resources and access to the Oregon Quit Line. So we're going to be providing follow-up care related to that. Also, the Healthy Athletes Program has the world's largest database on health for people with intellectual disabilities. So we collect all the data from all the health screenings, and they're put into a large database. And this includes data on tobacco use. There's actually not a lot of data out there in this population related to tobacco use, and the Healthy Athletes Program is actually one of the largest data sources on this particular health behavior. Next slide. I'm going to talk a little bit about that data, and particularly as it relates to Oregonian athletes. So on the far right, you can see Special Olympics Oregon. So these are athletes that were screened at our Healthy Athletes event at this past summer state games. As you can see, the use of tobacco products in Oregon athletes is 22%. If we compare that to SONA, which is our national Special Olympics athletes, and our global athletes, you see that it's 22% compared to 6 and 8%. So we see there's a big discrepancy there with Oregon athletes having a higher percentage. And you might be thinking that, okay, 22%, we just heard Angela say people with disabilities, over 40% of people with disabilities are using tobacco products. I do want to note that this could be a potential bias sample. We are actually thinking this is an underestimation of tobacco use in this population, because the way that we run the Healthy Athlete screenings is that athletes have to attend, they want to attend the screenings, they are included in sports and athletes who we think they're a little more on the healthy side, and they're voluntarily reporting that they're using tobacco products. So we would think that this is an underestimation, and if you were to ask a coach or a Special Olympics staff, they would also confirm that this is a highly prevalent issue in this population. And I also want to note on that second statistic there that over a quarter of our athletes are saying they're exposed to secondhand smoke. So this is extremely important to target since our population, for this population, since caregivers and coaches, peers are modeling and exposing our athletes to smoke, which we know is detrimental to our health. Next slide.
All right, thank you, Alicia. This is Shira Pope. I'm a Health Systems Policy Specialist in the Health Promotion and Chronic Disease Prevention section of the Public Health Division under the Oregon Health Authority. And now moving on to what we know, what works, and thinking about tobacco prevention as a comprehensive program. So there is robust evidence to tell us what works to end the tobacco use epidemic. The interventions that have the biggest impact, as you can see, include tobacco-free policies, sustained funding of statewide comprehensive tobacco prevention programs, increasing the price of tobacco products, hard-hitting media campaigns, access to self-management supports, and comprehensive point-of-sale restrictions. So in this project, we are focusing on tobacco-free policies and access to self-management supports, because these are strategies that are the most relevant for direct service settings. We will tell you later how a disability provider agency can support all of these strategies through getting in touch with a local tobacco prevention and education program in your county or tribe. So the Center for Disease Control and Prevention recommends tobacco-free policies as one of the most effective ways to reduce tobacco use. Not only do these policies help prevent exposure to secondhand smoke, but they also promote a supportive environment to help people quit. So based on a survey that disability providers completed in 2014, we know that 40% of providers said that their organization has a tobacco-free campus or grounds policy that helps or encourages employees and people with disabilities to quit. However, 35% said that they didn't have such a policy, and 23% said they didn't know. So for those of you working in residential settings who do not have a tobacco-free policy that applies to staff, clients, and visitors, establishing such a policy can have a great impact on encouraging staff, residents, and visitors to live tobacco-free. So for people with disabilities, these policies are very important. Non-smoking residents have the right to smoke-free homes. So this is a great opportunity for you to work with your local tobacco prevention and education program coordinator to establish these policies in your community. A few agencies indicated in the survey that they have comprehensive tobacco-free policies that go above and beyond the Indoor Clean Air Act. And additionally, the Center for Independent Living, as well as 2 local county developmental disability programs, provided feedback about tobacco-free policies. The Center for Independent Living said that they have a sign that informs people that the campus is perfume, drug, alcohol, and tobacco-free. New staff and clients are reminded of this as these things directly impact the health of everyone in the establishment. I just want to remind everyone to put your phone on mute if you are not currently presenting. Thank you. We can hear some background noise, so that would be helpful if everyone could put their phone on mute. Great. So according to the CDC, promoting self-management benefits through employee and client health plans is an important strategy to support people to get help to quit. So by benefits, I mean access to the Oregon Tobacco Quit Line, medications such as the patch or gum, as well as programs like Living Well with Chronic Conditions, Tomando Control de su Salud, or Walk with Ease. So for those of you involved in worksite wellness, this is a key strategy you already know is important. So for those who are state employees, the Public Employees Benefits Board offers a robust benefit for tobacco cessation and several self-management programs. If you work for brokerages and have a private health plan, it is worthwhile to check with the plan about what they cover. For the people who serve Oregon Health Plan members, there is a standard minimum level of cessation coverage available, and cessation benefits do vary by coordinated care organization. So for information about what those benefits are, we would encourage you to reach out to the CCO in your area. Regardless of insurance status, all Oregonians do have access to the Oregon Tobacco Quit Line. It's about finding out what self-management benefits are available to staff and clients based on their health and promoting these benefits as a way to support them to take care of themselves. So the good news is that among adult current smokers in Oregon, 2 out of 3 would like to quit smoking and 53% have tried to quit in the past year. So tobacco use is a chronic relapsing condition. Quitting is not easy and may take several attempts. So studies show that tobacco users are 2 times more likely to quit successfully if they receive help, specifically a combination of counseling and medication. And specifically, for what we're talking about today, 64.7% of Oregonians with disabilities who use tobacco would like to quit smoking. So this is definitely a population that we want to focus on and provide as many of the supports, both in the environment and these cessation supports as possible. So once you're oriented to what insurance-based benefits employees and clients have access to, this will be helpful since we know that most tobacco users do want to quit. So as mentioned earlier, people with disabilities are just as likely to want to quit compared to those without disabilities. And tobacco users are twice as likely to successfully quit if they use an effective treatment.
And I also want to emphasize too that for people with intellectual disabilities, they also want to quit and they can quit. I mentioned earlier there's not a lot of resources and research out there as it relates to tobacco use for people with intellectual disabilities, but in some of the smaller samples of 20 to 30 people living in independently, there are statistics to show that people want to quit, and they have quit in the past. That's really important to highlight. So in order for adults with intellectual disabilities to quit, there does need to be additional supports in place. So attempting to quit and accessing resources requires skills that those with intellectual disabilities may struggle with. And that includes things like self-confidence, planning ahead, remaining focused, having the self-control to resist urges, and truly understanding the long-term risks of tobacco use, what that looks like for their health in the future, and making sure that they understand that that outweighs that instant gratification of smoking or using tobacco products to either overcome an urge or a craving or just the instant gratification of those products. So social support is essential for success, particularly as it relates to role modeling. If an individual with an intellectual disability is around other people who are using tobacco products, they will be more likely to model those behaviors. So I strongly encourage you, if you're a coach or a caregiver that uses tobacco products, it could be a really good opportunity to support an athlete or someone with an intellectual disability by quitting together and really supporting each other on that journey. Also, that last note about a champion for change, just making sure that there's at least one support person for someone with an intellectual disability as they're going through the process of quitting. Because overcoming some of the challenges that I mentioned by yourself or alone could lead to failure or frustration for that individual. Next slide.
Great, thank you. So sometimes it takes several attempts, but each attempt is important and valuable. and options to help people quit. It's not just, you know, one option for the Oregon Tobacco Quit Line, but that there are also other cessation supports that could help someone quit, such as community-based cessation programs and online cessation resources. So about half of disability service providers said that they had heard of the Oregon Tobacco Quit Line, which is one of many available self-management programs that's available 24/7 in over 170 languages, both over the phone and on the web. So for people who are deaf and hard of hearing, there is a TTY line, or they use a relay service to connect with 1-800-QUIT-NOW, which is the number to call the Quit Line, and you can also see that there is an option available in Spanish as well. So regardless of whether someone is insured or not, they will receive a basic Quit Line service as long as they are over the age of 13, live in Oregon, and are ready to quit in the next 30 days. If they aren't ready to quit yet, they can still receive materials in the mail that will help them make that decision, and they can still ask questions about the Quit Line and available services. So how does the Quit Line work once you self-refer or when someone is connected through a referral agency? So for example, if you're already a referral agency, or if you want to become one, the person you refer will get a call from the Quit Line to register and are asked about their tobacco use, if they have any chronic conditions, mental health or substance use conditions, as well as if they have a physical disability or a developmental difference. So these questions are asked in order to establish an individually tailored quit plan. Then, depending on the person's insurance status, they are either triaged to their own health insurance plan's Quit Line, or they remain with the state-funded Quit Line. Everyone who contacts the Quit Line receives at least one counseling call, and the Quit Line tries to connect them to community-based resources such as living well with chronic conditions. After that, they begin counseling with quit coaches who use motivational interviewing techniques to help each person create a personalized quit plan. Quit coaches are trained to work with people with cognitive and/or physical disabilities and with those with sensory disabilities, including deaf and hard of hearing. And services are available in over 170 languages. The Quit Line provides re-enrollment in the program once every 6 months. So for tobacco users eligible for the multiple call program, this is a regimen of 4 calls scheduled around their quit date. Of course, inbound calls to the Quit Line are unlimited. Lastly, if the person is eligible for nicotine replacement therapy, which are patches and/or gum, they will receive it in the mail along with a quit guide directly to their house or place of residence. So Quit Line benefits are based on insurance status. We ask about insurance status and insurance plan during registration. Many people with insurance, including many covered by Medicaid plans, have Quit Line benefits through their own health plans and are not covered under the state Quit Line. So insurance status is tricky. We try to ensure that everyone who calls the Quit Line receives at least one counseling call, and we try to connect them with resources in their area. So for example, the Quit Line refers veteran callers to the 1-855-QUIT-VET hotline and to TRICARE. So the state does cover that first call for anybody despite their insurance status, and depending on, as you can see on this slide, if they are insured with a Quit Line benefit, then their health plan has negotiated their own benefit with the Quit Line directly, or if they're insured without a Quit Line benefit, then the state will provide one counseling call, and then the Quit Line will provide resources in their area and direct them back to their insurance for more information on what they're getting in their coverage.
And just to emphasize some practical potential counseling tips, social support for those with intellectual disabilities, really focusing in on that population. Again, coming back to the idea of social support and really having a caregiver, a coach, or a champion present whenever that person calls the Quit Line, so that after that call they can reiterate or repeat information that's really important for them and help them stay and plan ahead. Also, establishing roles for a support team, having more than one person on that team is important as well. Giving a person a role of, if that individual is having a craving or an urge for a tobacco product, that they can call that person. Or another person could be someone that goes to the grocery store with them whenever they buy these products. So just establishing clear roles for a support team. Some practical counseling tips. This is Some of this is more on our end at Special Olympics Oregon, but the first one here, providing a communication card for Quitline staff. Although Quitline staff might be trained in the area of working with cognitive impairments and hearing impairments, really providing just a clear communication card is something we're working on at Special Olympics, so they can clearly identify and if they're speaking to someone with an intellectual disability, and just some practical tips on how they can properly communicate with that population if they call in. Using adaptive materials is another thing we're going to be working on at Special Olympics, making sure that the Oregon Office on Disability and Health has appropriate kind of tools and resources based on language, including pictures and auditory media. Some other tips that might be useful is just making sure that terms are clearly defined during counseling, like urges and cravings, so people know exactly what that might look like or how that might feel or who they should call if those things come up. Adjusting the length of counseling time can also be done during the Quitline counseling session. So if they need more time for repetition, or if they need less time for if they have issues with attention span. So that adjustment of time, making sure things are repeated, and allowing time at the end of sessions to reinforce key concepts. And then finally, just emphasizing that quit date and planning it ahead. I mentioned earlier that these might be a struggle for this population, so making sure that there are supports in place and there is some repetition there as to what the quit date means and how they can plan ahead for that. And I provide a citation here. These are some tips that were found in the literature if you'd like to look that article up. Next slide.
So now that you know a little bit about how the Quitline works, I'm going to talk about how to get employees and clients connected to Quit resources. So we know that this topic is what a lot of you are interested in learning about based on what was indicated in the past survey and just general interest that's come through. The next few slides we will explain 3 ways of promoting the Quitline, including becoming a referral agency, sharing Quit messages throughout your agency, and promoting a new Quitline brochure for people with disabilities. So the first step with becoming a referral agency is to develop a system where during peer support or case management appointments, staff are asking clients if they use tobacco, advising them to quit, and if they're interested in quitting, referring them to resources such as the Oregon Tobacco Quitline. This intervention is highly effective and can be structured in a way that is client-centered using motivational interviewing techniques, such as the Ask, Advise, Refer method. On this slide, you can see an example script for how to use motivational interviewing when engaging a client about tobacco use. For those on this call who work in health systems, behavioral health, or other settings, it's the same idea with patient visits or client meetings. It's important to ensure that this intervention is an agreed upon protocol that is implemented by all staff in your agency. One example of how this can be done is to embed these 3 questions into intake forms or in other routine times when you're interacting with clients. In terms of actually making the referral for a client who is ready to quit, referrals to the Quitline can be made electronically through electronic health records if your system is built to support that function, or through fax or online forms. This is the most proactive way to connect someone with support. Once the Quitline receives your referral, a Quit coach will call your client directly and ask if they would like to enroll in services. If they accept, they can begin counseling immediately. This form of referral is much more effective in getting people to quit than handing them a Quit card. So an option for your agency to send referrals to the Quitline is through fax referrals, as I had mentioned. And so I've pulled up the Smoke Free Oregon website and I'm pointing to where this fax referral form is located. So again, this PowerPoint will go out after this with the recording as well so that you can all have access to this information. So this is the fax referral form that allows you to send a fax to the Quitline without having to have the client or patient sign their consent, as long as they have provided verbal consent to be referred. So all you would have to do is complete this information in the form and fax it directly to the Quitline, and they will call your client to enroll them in services. As you can see, this form is geared towards a health system, but also work well for disability provider agencies. And as I mentioned, we're really encouraging health system partners to move towards an electronic health record referral system so that that would create more efficiency for the clinic processes.
Okay, thanks, Shara. So I'm going to be sharing with you some more information and resources that can help people quit. So on your screen here you see several other resources, and one of them is the Freedom from Smoking, which is from the American Lung Association, as well as self-management programs, and those are both available for group classes and group support, which have been shown to be very effective in helping people make healthy behavior choices and changes. And especially with the self-management programs, tobacco is addressed in there as well, and we'll look at those a little closer here in a minute. Also on your screen you see that there is a curriculum that's specific for people with intellectual and developmental disabilities. It's a curriculum that can be implemented. It looks really good. I haven't implemented it myself, but it is free and available to download at the link there. And then lastly, like Shira has been saying too, to always think about what could be available through the coordinated care organizations or your private health plans. So this is a snapshot of the Oregon Health Authority Self-Management Program's front page. And when you go here, what you can do is you can find a workshop, a self-management workshop, which is an evidence-based workshop that is promoted and supported by Oregon. And so right there you see with the blue button, you can click on that to find a workshop. And then likewise, you can also click on the links down below and learn about the different evidence-based self-management programs that are available throughout the state. And those are listed on the bottom there. So this is an example of some of the smoke-free Oregon materials that we developed in partnership with the Oregon Health Authority, we being the Oregon Office on Disability and Health, over the years. And what you see here are some posters that are available at the Smoke Free Oregon website there. And you also see the call to click button there, which I'll talk about both of those. So when you go to Smoke Free Oregon, what you'll find is you can download posters, palm cards, and counter cards in a variety of languages that you see there, as well as the disability community, which has images of individuals with disabilities. So you have those available, as well as we see here with the second red arrow, the click to call button. And the click to call button you can download and put on your website to give easy access for people to access the quit line individually, like on their own. So this is another slide that helps demonstrate that. So it gives you the directions there on how to take that icon or that button and place it on your website, and again to give easy access to anyone that would like to quit. There. Okay. Also at Smoke Free Oregon, they have quit line stories, and this is a Word document that gives you some language and text, like a template for writing newsletters or a web story or anything that you would like to help promote the quit line through your agency. So that's very easily accessible there. Then also there are web banners that you can put on your website or in your newsletters or anywhere else that you want to advertise the screen as well. And this is what those quit line banners look like. So you can download a variety of options there. And then lastly, we also have a quit line brochure for Oregonians with disabilities, and I'll share that with you. So this is the front and back of that brochure. It gives some statistics and data, as well, of course, as all the information for the quit line. And then inside a little more information, and then highlights a success story by Gabby. So the next steps for our tobacco education project for people with disabilities is the Oregon Office on Disability and the Oregon Health Authority will be working with the local tobacco prevention and education programs that are throughout the state to see if there's ways that they can provide technical assistance at the community level for disability organizations interested in getting some technical assistance on maybe being a tobacco-free campus, wanting access to some materials and how to access those, and any other types of support that the tobacco prevention education coordinators can provide. We're also going to increase the number of disability-specific self-management educational and promotional materials. You saw some already developed through Smoke Free Oregon that we have available there. We're going to continue to develop any other materials that we see necessary as this project moves forward. We're also going to continue to track the monthly quitline reports to measure progress on how many disability agencies become a referral agency. We're able to do that, and then also track how many people with disabilities, and we have a few different indicators for people with disabilities, how many quit each month, or access the quit line, I should say. And then lastly, we are going to create surveys with interested state, county, or local agencies. So if you have an interest in this project and would like some more information or to help be part of gathering information, if it could be helpful for you, for the population you serve statewide, that is something we're going to be looking at doing as well. And Shira had shared with you some of the survey data results from our 2014 survey, so we're hoping to do another similar survey and compare the results of those to our 2014 survey.
And some of our next steps that we'll be doing with Special Olympics is trying to incorporate Special Olympians in the Oregon Office on Disability and Health and the Oregon Health Authority tobacco programming, and then providing adapted resources, including the communication card, line staff, and
we just want to remind everyone to mute your phone, please. We can hear some background noise. Thank you.
Yeah, so we'll just continue to support the Oregon Office of Disability and Health and provide adapted resources through the communication card for the Oregon Quitline staff, and providing health education programs like the I Can Quit program that Angela mentioned a few slides ago, and also just supporting any kind of resources that they would like to focus on for Special Olympian athletes and those with intellectual disabilities. We also plan to continue to screen our athletes at our Healthy Athletes events for smoking and tobacco use, and become a referral program. So if an athlete states that they use tobacco products, we will follow up with advising and referring them to the Oregon Quitline or to other resources with OODH or the Oregon Health Authority. We will continue to provide health education at competitions through our Healthy Athletes program, but also just have other pop-up events at local competitions that really help athletes understand the health risks of smoking and tobacco products. We'll incorporate resources and coaches training and competition packets. So our coaches are really important. They have the most contact with our athletes, the one-on-one time. They likely know who uses tobacco products and will likely be the most successful at providing resources and connecting them to the Quitline. And then finally, we're establishing champions for tobacco prevention and cessation. We're creating healthy habits coordinators, and these are our athletes and families who we're training to be our health coordinators or our health champions. And they are going to go into our local Special Olympics communities and really champion health. And part of that will be to help with tobacco use and connecting them to resources as well. Next slide.
Thank you, Alicia. All right, so that concludes our presentation portion of the webinar. And if you do have a question, please feel free to unmute your phone. I'm hoping that folks won't be speaking over each other, but possibly we can facilitate some of these questions. We have a few minutes to do so. You can also use...
I'm wondering,
oh, go ahead.
I'm wondering when somebody calls the Quitline, You showed on that one slide that OHA has those self-management programs you can look at online and you can find a workshop. Will they get referred to that when they call the quit line, or is that something separate we need to do with them?
So the quit line does have a list of community resources, including that information for the Find a Workshop feature on the Oregon Health Authority webpage. So if they have, if they've collected information to see that folks have tobacco use and also other chronic conditions, they would definitely refer them to that webpage directly. They have that information. Quitline coaches do.
Great, thank you.
Yeah, but we definitely encourage. Obviously, people need to hear information more than once. So if you want to provide that information from your direction as well, we definitely encourage that.
Got it.
Are there any other questions?
There's also a chat. Oh, sorry. I was going to say there's also a chat box if anyone wants to type out a question we can answer.
I had a couple more questions. Your slide said that those who are insured and have a quitline benefit, they get referred to their own insurance quitline benefit. Did you say all Oregon Health Plan CCOs through the Oregon Health Plan do have some kind of quitline benefit? Is that true?
They are all not contracting with the Oregon Tobacco Quitline. So if they are not contracting with the Quitline, they do have to provide some form of a telephonic counseling option for their members. So not every CCO is currently contracting with the Quitline.
But they would have a comparable program or something else that a person could go through?
That is as required by the Health Evidence Review Commission and the Affordable Care Act. That is part of the comprehensive cessation benefits.
Got it. And then my last question is that you had put a website up that was www.quitnow.net Oregon. Is that the same as the Smoke-Free Oregon, or is that a different?
That is different. You can access, so that is the web, option to access Quitline services and enroll directly into Quitline services through that website. The Smoke-Free Oregon website is just a connector to quit resources and how to help people quit.
Got it. Thank you.
Yeah. There was another question someone had. All right. Well, if there are no more questions, we will plan to send out this recording. We will also plan to send out the PowerPoint. And for those of you that are interested in captioning for this webinar, you can see the stream text link. We will send that out to anyone who needs captioning as well. So we want to thank everyone again for participating on this webinar, and please complete the survey that you'll receive the link to in your follow-up email. Thanks so much. And there are some additional resources that we've listed on the PowerPoint as well for folks that are interested in resources in your area. All right, thank you.